Whenever we talk about the veins of the heart, we have a rule called the 1-3-3 rule. 1 is the main channel of the heart, 3 major channels of the heart, and 3 minor channels of the heart. Let's talk about 1. 1 is the coronary sinus. Of coronary sinus, you can see that this is the anterior side, this is the posterior side. The coronary sinus is located in the posterior side of the heart in the left coronary sulcus. So I hope you can see it right here. This is the coronary sinus. And finally, we have the small cardiac vein on the right border of the heart, which goes and finally ends up in the coronary sinus, which is obviously the main channel of the heart. Then we have the 3 minor channels of the heart. So don't forget this important nerve lying superior to the root of the left side only, not in the right side. All right, so this is left recurrent laryngeal. Now, when you have done these relations, now go through DVD apple. What is D for? D is for the descending thoracic aorta. What is the V for? The ventricle. What is the D again for? The D again is for the duct. This is the thoracic duct. You can literally learn some of these relations. You don't need to know all of them, obviously. So plus minus ho jayega, that's totally fine. Bronchopulmonary segments is what's going to come in the exam. The question that they're going to ask you is, what are the bronchopulmonary segments? Draw them. Well defined. Anatomical, functional and surgical sectors of the lungs are bronchopulmonary segments, and they are 10 in number in both of the lungs. Really hope कि आपको like help हुई है इससे, आप लोगों को overview मिल गया, पूरे thorax को आपने ऐसे ही पढ़ना है. Stress नहीं लेना, इतनी overwhelming चीजें ना पढ़ा करो. Go very आराम से, go through the most important concepts. This is called smart study. You have to study in a smart way. You can't like do every single thing in the last days. All right.